The Ministry of Health continues its drive to lower Trinidad and Tobago's infant mortality rate with the installation of 4 ventilatory support machines at the Sangre Grande Hospital. The charge was further fueled by a UNICEF report released earlier this year, which named this country as having the highest neonatal mortality rate for a high-income country. Janine Brown reports.
To establish a neonatal intensive care unit at the Sangre Grande Hospital is underway, with the facility having been recently outfitted with 4 ventilatory machines. As this setup demonstrates, the machine provides newborns who suffer with respiratory difficulty the opportunity to receive treatment without having to be transferred to another hospital. Neonatologist Dr. Marlon Timothy plays a pivotal role in this area of development and says it's not only about reducing mortality rates, but bringing Trinidad and Tobago closer to international health standards.
We will continually train and update our staff, and that's something I firmly believe in. That's my mandate. I live by that. And we want to deliver the best level of care that's also evidence-based, right? So we're not using care from 1975. We're not using care from 1960. We're keeping up to date, and we're providing the most technologically advanced and supportive care that we can.
Health Minister Terence Dialsing says a NICU is an important feature to have in hospitals as it lowers the chance of tragedy when newborns have to be taken to another hospital for treatment.
And any doctor will tell you in those first few critical hours, if you don't intervene immediately, by the time the baby reaches Mount Hope, the prognosis is not as good.
Minister Dialsing says improving Trinidad and Tobago's infant mortality rate is of tantamount importance. The ministry is simultaneously working to improve existing NICUs such as the ones at San Fernando General Hospital and Mount Hope Women's Hospital. Minister Dialsing said that these efforts will work alongside other policy measures.
Other policy interventions will be things like training. How do you help with the difficult deliveries? So Dr. Adesha Singh, who is the Director of Women's Health, has been leading the charge in training our midwives, our obstetricians, as to how to cope with the difficult deliveries.
The NICU at Sangre Grande is hoped to be fully operational by the year 2019. Janine Brown, C News.
Health Minister Terence Dialsing says he is working to wean the public health sector off of its dependence on private hospitals. Minister Dialsing addressed the matter during a media tour of the Sangre Grande Hospital on Friday.
Right now we have to pay to send our public sector patients who need radiation therapy for cancer to either one private provider in San Fernando or one in Port of Spain. This administration has made the bold decision to reduce our dependence on the private sector for these services.
He said instances in the past have shown the dangers of depending on the private sector for critical health services.
It is no secret that 2 private providers, Medcor and St. Augustine Private Hospital, with very little notice because we could not pay bills at that time, decided to just stop their dialysis services. Now, that sent a message to me that we need to do more of these things in-house.